Hello, everyone. I'm very happy to see all of you and welcome you to another episode of Words of Wisdom with Dr. K. Today, I want to discuss something that is really for clinicians only. And I'm sure you've all had the experience of trying to work with the silent patient. Now, there are many reasons that a patient can be silent. Is the patient angry, hostile, doesn't want to be there, sent in by the police, sent in by the school, is defiant at home? Perhaps it's somebody who is having a great deal of difficulty as a new immigrant and doesn't speak the language. Or perhaps it's somebody who is cognitively impaired and can't speak. Or perhaps it's selective mute. We don't know. Nevertheless, you've all have had this experience. So today I'm going to give an example, a practical example of what could actually work when you're dealing with a silent patient. The silent patient can be any age, of course, but I'm speaking mostly for children of, let's say, 6 to 14, because many of you who are child psychiatrists or who will see a child in the emergency room will want to be able to do this. Now, the technique that I'm using is something that I actually invented many years ago from art therapy. And it's something that I think very good behaviorists can do now, and I think you could do it. I've had a lot of success over the years teaching this particular technique. Now, the first thing is that you really do need to have some kind of impression of the child. And that's why if you can have other material before you, it would be very important. Very often, though, a child is monosyllabic, doesn't say anything, and maybe one word answers or looks bored or turns away, and that's very hard to deal with. So it's very good if you have that impression before you even begin. When you know you're going to see a child, that you're going to use this particular technique, you need to have the equipment, and the first thing would be colors. It could be crayons, it could be acrylic, it could be pencils, but colors like this. The next thing you need is, of course, a piece of paper. The technique that I'm going to describe, first of all, involves color. Now, children know a lot about emotions. They may not know the word for it, or they may not even want to talk about it, but they certainly know emotions. And that many of them know it from the movies they've seen that have to do with emotional states, or they certainly know it when somebody tells them. When I see a child where I've had some information, I don't have to ask, why are you here? What happened? They're not going to tell anyway. So I have to say something else. So I say, but we're going to do something else today. It's kind of a game. I want you to think about a color of any emotion. Now, what emotion do you think you could talk about? Sometimes the child might actually say sad or glad or happy or scared. Sometimes nothing. So you might say, here's a crayon, pick any color that you want for a feeling of happy. And let's say the child makes a key. Happy is yellow, sad might be purple, anger might be red. Whatever color the child picks, it's not your color, it's not one that's in any book, and that is a key that he devises on the spot. You can help. If he doesn't know how to spell the word, you write it. But the kid usually will do this. If it's a child with separation anxiety, a parent is often there. If not, he'll come in by himself. And you say, hi, I'm Dr. K, and we're going to have a fun time today. What's your name? He perhaps will answer, and I'll say, okay, I could just call you No Name and make a little joke to see if there's any humor. Usually they'll tell their name, Jimmy, say, or Mary. Now, what I want you to do, make a list of the colors that you like that are going to go in a circle. Can you draw a circle? Sometimes the child can, sometimes they don't. Sometimes it looks more like a square or an egg. It doesn't matter. You just need a circle. So if necessary, you draw the circle. And you say, now we're going to have this circle is going to be a happy day, a good day. And then another circle, a child often will do it, and that's a bad day. Now let's take the colors that you've picked on the happy day. And then you watch. You want to know, how does he hold the pencil, the crayon, stay in the lines? Is it squiggly all over? Take many emotions and squish them all into the paper. Very neat. Make a pie. It's very interesting to see how the child will use the circle. You say, okay, well, let's start with, you want to start with the happy day? And sometimes the child will just fill in pale pink or purple. And you say, what is that? And they say, well, that's just an ordinary day, doesn't have any feelings. And he did say something. Oh, okay, it's an ordinary day. Well, let's take a happy day. Oh, I see you've put yellow for happy, and you've put a little bit of red line. I don't know what that is. And here's a dark line. So even in the happy day, there were some things. What could that be? The child may actually answer and say, it was a happy day because it was my birthday party. Or it was a happy day because we went to the circus. Oh, he told something. If he doesn't say anything, you say, well, let's pretend that there's a boy in your class and he had a very bad day. What would he do like on that day? Now you have a happy day and a bad day. This is a technique that I've had a lot of success with girls and boys, but I'm going to present a case today, an actual case of, let's say his name is Jimmy. Now, Jimmy was a child without any serious behavioral problems or school academic problems. There had been no trauma, no divorce, no loss. There's nothing. And yet the school called and said that Jimmy refuses to go to school. He ran out of the school and he wouldn't come back. And his mother had no idea. Father was away. They brought him to the emergency room. The emergency room doctor had little information, very good student. He'd been fine. He'd never missed a day of school. Not sick. Nothing had happened, according to the mother. But he refused to go back. So I knew that I had to have a different technique. And that's why the colors, the pencils, the paper, and him. It happened to be a school that was connected with the hospital so that the services were done in the school. So I said, hi, Jimmy, I'm Dr. K. I'm here today because I know that you didn't go to school for a few days, and I'm wondering that if we just can't have some real fun here today, we're going to do something a little different. I want you to pick out the colors that you have for any feelings that you have, and if you can write them, the word out, I'd be happy. If not, I'll do it for you. So then he did the color chart. Happy was yellow, anger, red, very, very sad, black. He had his own colors. And I said, well, that's great, that's the color key. Now can you draw the circle? And he did. I said, well, let's pretend that this is a happy day that you remember, that you felt very good, and let's put in the colors for happy day. And he had a lot of neutral color first. You could judge how a child does, how he holds the pencil, fills in the lines, what he does. And in this case, he didn't say anything. I said, well, this seems like a pretty happy day here, but this sad day looks scary. What's going on? And he said, it was a happy day because it was my birthday and I had fun and it was nice. But sad day is because of Johnny. What happened with Johnny? It was a very bad day. What happened? And he began to talk. Johnny always is cheating. He's always trying to cheat in the test, and he leaned over to look at my paper. So I wrote him a note, don't look at my paper. And the teacher saw it and came back and said, you're both punished. I'm giving you 0 for talking in the test and for cheating in the test. And Johnny said, if you say anything to anybody, you tell my mother, I'm going to get you. I'm going to beat you up after school. I said, well, this is terrible. This bad day, and it's not your fault, and that's very unfair. Do you think that there's a way that we can tell your mom what happened? Why didn't you tell her? And here he is talking, explaining the whole thing out of this picture with the feeling. He said, because she would call the school, and then they would call in that Johnny would beat me up after school, and I was afraid. But you know what? I have a feeling if we brought your mom in and told her, do you think that you could tell her what really happened? And he said, yes. So we brought in, showed the picture, showed the feelings, showed the happy time, the bad time. And Mom was very surprised. I said, it's very important that your mom knows and the teacher knows. The teacher was very good. She told the mother, that's the boy that we've had trouble with, and I'm sorry I wasn't paying attention. Meanwhile, Jimmy was very happy. And I said, well, we can meet again. Do you want to come again? He said, yes. He had a lot of days that he wanted to write down, a lot of things he wanted to talk about. In fact, he didn't shut up. And here he was, had run out of the school. He never wanted to go back because he was afraid he would be hurt. Well, I only saw him 3 times. The teacher handled it, happened to be in a good school. Let me just say to all of you, perhaps you're not in a school where the teachers are really listening. There's burnout. It's been very difficult for some of you, for all of us in this situation. But I know that a situation like this can be helped, even if you see the child only one time. Using this technique can be very helpful in getting children to talk and relate. I have presented one case of an example that was very successful, but I think all of you have similar examples that you could use. In future episodes, I would like to discuss mutual storytelling technique and my version of squiggles. So until I see you again, goodbye for now.